Hello everybody, it's lovely to be here today and really good to be back at the National Voice event. For those of you that aren't aware of our team, we are the SDS project team within Social Work Scotland. On screen with me today is Laura Finnan-Cowan, who's one of our project officers, and I'm Jane Kellock, the project manager for the team. Unfortunately, Donna is having technical issues, Donna Murray, and not able to join us for the presentation today. And we also have at the conference, but not joining us either, is Callum Carlisle, who's our project assistant. So feel free to contact us at any point if you would like some more information about the work that we do. We're funded by Scottish Government, have been for a number of years now, and we're hosted by Social Work Scotland. Social Work Scotland is the national leadership organisation for social work. Our project aims to improve the competences, the processes and the leadership that underpins SDS, using the SDS standards as our benchmark of what good looks like. We know from the My Support, My Choice research that Donald mentioned earlier that SDS works best when supported people and carers have a good relationship with their social workers. There was a quote in that national report that said, "I think that's one of the most important things. If you haven't got somebody you can approach easily, then SDS might not work as successfully as it worked for me." That was somebody who obviously had a good experience of engagement with their social worker. And I think for me there, one of the key words is easily. So there's something about accessing the system with ease. That's for the supported person. And also, as I'll speak a little bit about later, that's also, we need a certain amount of ease within the system for workers to be able to do their jobs properly. Feely, in the Independent Review of Adult Social Care, said that Scotland has good strategies but poor implementation. And it's this implementation gap that we are set up to try to address. The gap's often referred to in terms of the difference between what's set out in legislation and in guidance and what actually happens on the ground. And Feely also said that we need science-based improvement methods to bridge that implementation gap. Our project team uses a science-based approach called active implementation to take evidence from supported people and carers about their experiences of SDS and what social workers have told us about their experience of delivering SDS. And we look across the whole system to where improvements are needed. So we gather evidence of people's experience of the system through two mechanisms, main mechanisms. One is through the national collaboration of SDS stakeholders, and the other is through a community of practice of SDS leaders and workers. Laura's going to move us on the slides. Thank you very much. So Donald mentioned the SDS collaboration earlier on. It began as the steering group for the project and rapidly gained its own momentum. And we're really pleased to have so many members, member organisations part of this collaboration, from Scottish Government, social work organisations. This slide represents just some of the main contributors, but more organisations asked to join us on a weekly or monthly basis. But you can see a range there of different organisations. All of us are stakeholders in SDS across Scotland, and we particularly value those in the national collaboration space who represent the voice of lived experience. That's really helpful for us and really important to any of the work that we do around the system redesign. So together we help to implement self-directed support policy and priorities. We work closely together to collaborate so that we're not duplicating, but that we're actually using collaboration to enhance and to amplify everybody's voice in that space. We're also keen to identify the challenges and the priorities and opportunities within the space as well. And we don't shy away from challenge or controversy. We don't shy away from the difficult topics. I think we use our different perspectives to try to shine a light and look for a common understanding and a common way forward. Recently, the National Collaboration and ourselves worked with COSLA and Scottish Government to help with the review of the statutory guidance for SDS. We've also learned about the United Nations Convention on the Rights of People with Disability and on digital developments like the 247 grid. We've been working over the last few months on the improvement plan for SDS and supporting wider consultation with our respective members. And we also get the chance to monitor the improvement plan once it has been approved. So the collaboration is really strong in all of those areas. We kind of have a two-pronged approach. One is to join together in the implementation, and the other is to use our collective voice to influence out the way and into government and into local government. We also, in the last year, have developed another collaboration. We're calling this the Community of Practice. That's on the next slide, Laura, thank you. And the Community of Practice brings together local authority colleagues from every local authority in Scotland on a regular basis. We have represented in the Community of Practice social work assistants, social workers, we have managers, middle managers, we have SDS leads, we have very senior leadership, we've got people from finance and commissioning in that space and chief social work officers too, all of whom are responsible for the delivery and implementation of SDS in their areas. We launched the Community of Practice in its current iteration, which is as a much more of a kind of a learning space, in August last year, and we worked very hard over the summer and the autumn to get to an understanding of what the key priorities are for the Community of Practice. We asked them about the challenges faced by social workers and paraprofessionals, what are the difficult issues, the hot topics that they had. We asked them about how the system is or isn't working in a way that allows them to practice as they've been trained in a relationship-based way, and to ensure that supported people have choice and control. So how easily can they do their job? And we also asked about the role of leadership around SDS and how the local context can be either enabling towards the practice of SDS or disabling. We got an understanding of local variation and how SDS implementation might look different in Shetland, say, compared with Edinburgh. We got to see what different systems looked like and the different approaches to implementing the SDS standards, and how people are starting to evaluate what good SDS looks like. We've looked at how people train their staff, how communities are empowered, and been able to share that learning with leaders, with Scottish Government and also with COSLA. In return, the team act as a kind of a link between Community of Practice members and our active implementation learning, how we might test out practice and methods for breaking down issues into manageable chunks, and looking at solution-focused action within work streams that bridge that implementation gap. The Community of Practice does need its own space. It's a space for local authority members, but they and we are very keen for collaborative working across the Community of Practice and the national collaboration, particularly around the work streams that we're beginning to develop and that are appearing now in the draft SDS improvement plan, and that we will be moving forwards on from the beginning of April. I want to say a little bit more about the approach that we're taking, this active implementation approach that I've been talking about. And we've developed this graphic to hopefully show something of how we perceive what the system looks like really. This is one of the frameworks in active implementation that we use quite a lot. On the screen in red, you see the 4 key outcome areas that the improvement plan will address. So right at the top, and the most important one, is the supported person carer's choice over their support. That's what guarantees success of SDS. We see that envisaged by the supported person having a voice, being able to talk about what matters to them, and ultimately to achieve my life the way I want it. They're the ones with the ideas of what that might look like. And we know that there are a range of individuals and organisations that sit around the supported person to support them to get the life that they want. That might be family members, it might be carers. For young people, it might be their parents. It can be independent support organisations as well. And it's important that workers, represented by the other head in the diagram, and the supported person can have the time and the space to have good conversations about the way that the supported person wants their life to be lived. It's really important, and we stress the importance of relationship-based practice here, because it doesn't always happen in that way. We've had a system of care management in place for a long while now, several decades, which very often mitigates against that relationship-based practice, and we need to start to redevelop that and what that looks like. If we think about that conversation happening kind of above the line, if you like, in the visible space, what the worker then has to do is to mediate all of that good conversation with the bigger system. So the worker has to go through the door of what is a large, complex system within integrated health and social care partnerships and within local authorities. An active implementation says that there are three kind of axes that are important to look at here. The first one is the worker skills, practice and autonomy. That's our second outcome area within the implementation plan. And within that, that's all about how workers get, what their roles look like, what the workforce capacity is to allow them to do the job that they need to do, what training looks like, and we don't have good standard training at the moment for social workers. We also need to look at things like job coaching, professional autonomy, peer support, and how we would evaluate what quality support looks like. So there are a lot of things that need to be attended to there, and you'll see that when the improvement plan comes out. The worker, in order to do their job, if they have all that good quality training and enough time to do the work that they need to do, need to have systems that back them up. So the systems need to be easy for the worker and the supported person to access. We need to be able to identify personal budgets easily. We need workers to have delegated authority to approve the use of small budgets, and to have an easy way to get budgets approved within the system. We need there to be recording processes that record good conversations and the outcomes that matter for supported people. And we need to look then at our IT systems, how we gather data, and also what digital solutions are available to enhance that person's life without duplication or without difficulty. And underpinning all of that is good leadership. One of the really important things that we need to understand here is that there are lots and lots of leaders in that space. There are leaders in the traditional way in terms of management, but there's also leaders in expertise. And we need to appreciate and see supported people being brought in as leaders in their own right into that space to help to improve the systems. We need to understand that there are other professions in that space too: finance, commissioning, health, education. And we have to have a focus around helping the workforce and the supported people to get to where they want to go. We need to look at the adaptive problems and really get behind that. So I hope that slide says something about the way that we think about the different outcomes in that space. Not everyone will share this view, but this is the perspective that we're taking. So we've introduced that approach to the national collaboration and also to the community of practice. And we worked with the community of practice around that space to think about what are the priorities. So a couple of slides about what they identified in that kind of research that we did with them over the summer and autumn. They absolutely ratified the work that was already underway, that the project is undertaking at the moment. So work around developing an approach to self-evaluation. This is about learning how to do SDS better. It's all about a learning approach because we know there's a lot to be done. So how can we help local authorities to evaluate what they're doing against the standards and to think about what they need to do next. They also ratified our work around SDS resources. We have done a lot of work over the years on that. There is a tool out at the moment for evaluation around a toolkit for social workers about accessing good resources. They also identified about 9 other priority areas. On this slide are the top 4 that they identified. Relationship-based practice, which we've talked about earlier on, about moving from care management to relationship-based practice that focuses on what matters to the supported person and plans for good person-centred outcomes, absolutely key. They also identified consistency and roads less travelled. This harks back to what Donald was saying earlier about ensuring that all care groups have access to SDS, all the care groups that should have access to choice and control do get that, and that's not the case at the moment. We need to think about consistency, not just across Scotland, as has been identified before, but also within local areas, to make sure that everybody has access to SDS. They identified resource allocation as being an issue, about reviewing approaches to resource allocation and the systems that are in place, and about training and practice development and coaching. They've definitely ratified the need for training, and we know that the My Support, My Choice identified that as well as being an issue, and we're in a really good position to harness the good work that's been done around the community brokerage training and adapt that for a social work audience. Thanks, Laura. 5 other areas were identified: budget approval processes, redesigning processes so that the approval for personal budgets is straightforward, again, easy to access, and that we get delays designed out of the process. We know that local areas need to review their local policies and procedures, and we want to support them through the community of practice to do that. We want to have a think together in the community of practice about what good leadership looks like, and I think it would be really helpful for leaders and also for workers to identify actual behaviours and activities and actions that leaders need to take on the ground. We have done quite a bit of work around what worker autonomy looks like and delegated authority, and there's some movement on that in Scotland, and we've seen some good results from our focused implementation work already with 3 local authorities. And we need to also look at the balance of job roles for social work, and we know there's a lot of specialist in-house roles there, and we need to have a look at them as well. At the heart of improvement is the review of the SDS standards, which Donald referred to earlier on, and Laura is going to speak to in a moment or two. And the review of standards is about making the standards relevant to all the care groups and linking into practice resources. Thank you, Laura. So we'll hand over to Laura now. She's going to take us through the rest of the slides. Thank you.
Thank you, Jane. So Jane has just introduced us to the priority areas that our community of practice, our local authorities have identified, and we hope to take forward pieces of work as our dedicated work streams that are related to those priorities. And those will be distinct pieces of work. They will have their own working group, their own work plan, and they'll go off in their own direction. However, it's important for us, for each of our areas of work, to have certain things in common, to have a consistent foundation. And we'd like to introduce you to our thinking around that so far today. So first of all, we want our approach to improvement to always be driven by co-production and relationship-based practice, working together, building trust, and everyone being heard. All of our work, as Jane has said, will be evidence-based, and for us that means working with the frameworks within active implementation, because we want methods and tools that are going to be fit for practice across our Scottish localities. In each area of our work, we will consider the best use of digital technology, and throughout all of our work, we will be thinking about the widest possible group of people who have the potential of using SDS really successfully to make good lives. So when we're talking about this, we really mean right across the age range, and we also, as already been mentioned a few times today, for those people who SDS is not at the moment an option. We'd like to go into a little bit more detail just in two of our work streams, and multitasking there, moving on the slides. Apologies, folks. Yeah, I'd just like to talk firstly about the direct payment agreement for employing personal assistants. So our evidence from the health and social care partnerships and local authorities and from employers and PAs is that there's very wide variation between each local authority and what they include in a direct payment for people who employ a PA, both in adults and in children's and family services. And this is things like rates of pay, the support to be an employer, funding and help with recruitment, things like holiday cover, support for payroll, ensuring that people have access to independent support and training for PAs. Health and social care partnerships have expressed an interest in having guidance on best practice and also an appetite for developing a collaborative agreement across Scotland. We gathered together an expert group, so a subgroup of the PA board mentioned earlier, which includes employers, Scottish Government, Centres for Inclusive Living, independent support organisations, disabled people's organisations, PAs and COSLA to have oversight of this work, which is funded by the Scottish Government. This work connects directly to the work being carried out by the Fair Work area of Scottish Government. We've just completed a survey of all the health and social care partnerships to gather evidence on current practice and processes. This is currently being analysed by an expert group, and our next stage is to engage more fully with Centres for Inclusive Living and disabled people's organisations and independent support. We need to gain an insight into the current experience and what's working and what isn't. Together with evidence from both of the groups, we will start to agree principles and core components of that agreement. It will then be taken out for testing and refinement. Throughout all the processes, we are building and supporting relationships and building trust. We are gathering evidence and using an active implementation approach. There is no point in having an agreement sitting on a shelf or a website. It needs to be implemented and regularly reviewed. I know today there will be employers and PAs, health and social care partnerships who administer DPs, so please can I extend a warm invitation to get involved in this work. So that's the work that's happening with our direct payment. I'd also like to now talk about the work that's going to be happening very soon in relation to the review of standards. When my clicker works, there we go. So the second area we want to talk about is the review of standards, and I'm sure lots of people in this audience today will know about the standards that were developed by Social Work Scotland and their many partners a few years ago. In fact, I'm sure many of you assisted in this work to one extent or another. In developing the standards, the necessary key ingredients of the successful SDS recipe were explored and agreed. The standards defined what good SDS looked like, and this was important because we'd never had that before in Scotland. The Scottish Government published the standards in March 21, and COSLA, the Convention of Scottish Local Authorities, endorsed them too. That gave us 11 standards and practice statements relating to the important aspects of the SDS experience. And alongside these core components gave us the vital ingredients. Standard 12, access to budgets and flexibility of spend, was added in 2002. Because this was a really co-productive process that involved a wide range of stakeholders, people with lived experience, people who have experience of the practitioners who deliver SDS, the leaders, independent support, scrutiny, academics, we're fairly sure we got a lot right in that process. But 2 years on, it's time to reflect. The context has changed. We've learned a lot more about successful implementation of SDS and built new partnerships since then. So we'll take this opportunity to revisit our shared Scottish SDS standards and consider the impact they've made so far. Think about how inclusive the standards are and how we might maximise their potential. I'll be leading on this work on behalf of Social Work Scotland's SDS team and would encourage people in the virtual room to get involved. We need to reach a wide range of stakeholders this time and include new people in the conversation. And as well as this, we'll need to explore what will we do with the standards, what can be done with them, what can they be made into so that they have the most positive impact on SDS implementation. I'm going to be running a workshop this afternoon, but acknowledge not everybody can be there. So if there is interest to get involved in this work, don't worry, there'll be lots of opportunities, but please feel free to register any interest in the chat box that you might have, and I can follow up with you after today. On behalf of the team, I would like to thank Social Work Scotland for inviting us to present today at the conference, and we'd like to open up for any questions.
Thanks, Laura and Jane. It's good to see you today, and thanks for presenting on that. It's really interesting to hear about everything you've achieved and what's coming up. We've had one comment, and it's from Jim Elder-Woodward. I think it was in relation to, it came in when you were talking about the community of practice priorities. And I think you might have touched on some of this in the rest of the presentation. It was saying that there was nothing there about people's rights, rights to information, independent advocacy and independent appeals system. So if you have any thoughts about how those are going to be addressed, whether it's in the community of practice, the national collaboration?
Yeah, I think, there's absolutely nothing in our work that would preclude any of those developments. I suppose thinking about the kind of golden threads that kind of run through all of the work and that will appear in the improvement plan when it comes out, I think the human rights are absolutely fundamental. The rights of people with lived experience are absolutely fundamental to this process. It's the case. And all of the work that we do has to be centred around the experience of supported people. What we do recognise in this project, though, and because we are hosted by Social Work Scotland, is that very often it's the processes and systems that are kind of out of sight that are the ones that really are problematic and really delay decisions getting made and don't allow for that voice to be heard right the way through the system. And that's what we're really keen to work around and to use our expertise. We're obviously aware we work within a national collaboration space that includes others who will work more directly with the independent living movement and with centres of inclusive living and the organisations that supported people. But we do work very closely in the national collaboration, as Donald and Bex both know, and absolutely want to involve everybody as much as possible in the work. So the work streams that we're going to be hosting next year will involve members of the community of practice, the workers and leaders, but also supported people that represent supported people organisations, so that we'll make sure that the systems and processes are fit for purpose. Hope that's helpful.
Yeah, thanks, Jane. I thought the same as well. That much of this will be, I hope people will see much of this identified in the golden threads that are in the improvement plan, and we'll certainly pick it up within the national collaboration. So thanks, Jim, for that comment.